Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 2nd, 2025. This video is on a Lancet article published online on October 27, 2025, titled Percutaneous Transcatheter Valve Replacement in Individuals with Mitral Regurgitation Unsuitable for Surgery or Transcatheter Edge-to-Edge Repair, a prospective multi-country single-arm trial. There's an accompanying commentary titled Transfemoral TMVR, that is transcatheter mitral valve replacement, turning promise into practice. Severe mitral regurgitation, often unsuitable for surgery or transcatheter edge-to-edge repair. So this study cohort comprised of 299 individuals treated at 56 centers across 6 countries, median age 77 years, 51% men, 49% women. It was a prospective, multi-center, single-arm pivotal trial using the SAPIEN M3 system. The follow-up period, median 1.4 years, 283 individuals, that's 95% of the cohort at 30 days, and 243 individuals, 81% of the cohort at 1 year. Statistics, Kaplan-Meier, performance score comparison, and paired tests. What did they find? The primary endpoint, all-cause mortality or heart failure hospitalization at 1 year, was 25.2% versus the goal of 45%, p-value 0.0001. Mortality was 13.9%. Heart failure hospitalization was 16.7%. 96% had MR less than 1 at 1 year, less than 1 plus at 1 year. Safety, no intraprocedural deaths. Disabling stroke 3.9%. Valve thrombosis 6.7%. Limitations, single arm design, highly selected population, short follow-up. Key takeaway, transcatheter mitral valve replacement is effective and safe in patients unsuitable for surgery or transcatheter edge-to-edge repair. Editorial insights. Context commentary on this trial, which is introducing a third interventional pathway for inoperable mitral regurgitation patients. Durable mitral regurgitation reduction, 96% had less than 1 plus mitral regurgitation. There was no intraprocedural deaths, preserved valve-in-valve pathway, strong procedural profile. Caution, about 75% screen failure. Stroke occurred in 9%, and thrombosis in about 7%, requiring strict anticoagulation. Hemolysis was linked to paravalvular leak, around 7%. The forward view, expand anatomical eligibility, refine anticoagulation, iterate device to reduce paravalvular leak, and evaluate long-term durability. The bottom line, transcatheter mitral valve replacement is moving from promise to practice, reshaping mitral regurgitation treatment for anatomically complex patients. Clinical pearls. Percutaneous transcatheter mitral valve replacement provides a viable option when surgery or transcatheter edge-to-edge repair is not feasible. Durable mitral regurgitation reduction supports favorable remodeling and quality of life improvement. Low procedural mortality reflects minimally invasive transseptal delivery. Anticoagulation adherence critical to minimize thrombotic events. Further re-intervention feasible. Lifetime management advantage. These are some of the eponyms used in the study. Hit pause to read it at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.